All right, today we're jumping into a diabetes drug that really shook things up. It's a drug that basically ignores insulin, and instead, it uses your own kidneys to literally flush excess sugar out of your body. Now, this totally new way of thinking brought some incredible benefits, but it also came with a whole new set of pretty serious risks. We're talking about Canagliflozin.
I mean, it sounds a little weird when you say it out loud, right? But that's the question at the heart of this entire class of drugs. What if instead of messing with insulin, you could just find a direct escape route for all that extra sugar? Well, that's exactly the idea we're going to unpack.
And that's where Canagliflozin, which you might know by its brand name, Invokana, comes into the picture. It's what's called an SGLT2 inhibitor, and its whole strategy is, kind of brilliant in its simplicity. It turns your kidneys into a one-way street for sugar to exit the body. This was a massive shift away from traditional diabetes treatments.
So to really get how this works, we need to meet the main character in this story, a little protein called SGLT2. The best way to think of it is like a tiny, super efficient security guard posted inside your kidneys. Its one and only job is to grab sugar that gets filtered out of your blood and pull it right back in, making sure none of that precious energy goes to waste.
Okay, so let's just walk through the normal everyday process. Your kidneys are filtering your blood 24/7. As you can see here, sugar gets filtered out right along with all the other waste products. But your body's smart, right? It doesn't want to just throw away good energy. So that SGLT2 protein, that little gateway, swoops in and reclaims about 90% of it, sending it right back into your bloodstream. Only the actual junk becomes urine.
So that's the normal process. But what if you could jam that gateway? What if you could stop that reclaiming process from ever happening? Well, that's exactly what Canagliflozin was designed to do. It's a precision blocker for that SGLT2 gateway.
And this just shows you the difference perfectly. On the left, business as usual. The gateway is open, sugar gets reabsorbed. But on the right, when someone's taking Canagliflozin, that gateway is slammed shut. The sugar is blocked. It has nowhere else to go but out of the body in the urine. That's a process called glucosuria.
Now, forcing all that sugar out of your system doesn't just do one thing. It actually sets off this incredible chain reaction, a whole cascade of positive effects that go way beyond just lowering blood sugar numbers.
So, of course, the most obvious benefit is better blood sugar control. But then you get this ripple effect. Since sugar has calories, peeing it out means you lose weight. That sugar also pulls water out with it, which helps lower blood pressure. And this is the big one. Major studies showed it gives powerful protection to both the heart and the kidneys. Plus, since it doesn't directly impact insulin, the risk of your blood sugar crashing, hypoglycemia, is actually really low when you use it by itself.
And just to put a number on that weight loss, we're not talking about a huge amount, but it's a very real and sustained drop of about 2 to 4 kilograms. That's somewhere around 4 to 9 pounds, which is a pretty nice bonus that comes just from flushing out those extra sugar calories day after day.
Now this is what made this drug a true game changer. It wasn't just about managing diabetes anymore. For patients who already had heart disease, it was proven to reduce the risk of major events like heart attacks and strokes. And for people with diabetic kidney disease, it actually slows down the damage. This was huge, a massive step forward.
Okay, but that unique mechanism, the one that forces sugar out through your urine, it's a total double-edged sword. It's the direct cause of all those great benefits, but it's also the direct cause of the drug's very unique and pretty serious risks.
The most common problems pop up exactly where you'd think they would. I mean, if you create a warm, sugary environment in the urinary tract, you're basically rolling out the welcome mat for bacteria and yeast. So this leads to a much higher rate of genital fungal infections, that's the #1 side effect, and also a higher risk for UTIs.
Now, moving into more serious territory, there's the risk of something called ketoacidosis. This is a really dangerous state where your body gets confused by the lack of sugar signals and starts burning fat way too fast, which makes your blood become acidic. And what's especially tricky about this is that it can happen even when blood sugar levels look normal, which makes it incredibly hard to catch.
And the list of warnings doesn't stop there. Because the drug makes you pee more, dehydration is a real risk, which can sometimes lead to acute kidney injury. Those UTIs we mentioned, in very rare cases, they can get really bad and spread into the bloodstream. On top of that, there's an increased risk of bone fractures and an extremely rare but horrifying flesh-eating infection called Fournier's gangrene.
But there was one risk that really stood out from the pack, the one that became uniquely linked to Canagliflozin, even compared to other drugs in the same class, was a very stark warning about lower limb amputations.
Yeah, you heard that right. A major clinical trial found a truly shocking statistic. Patients taking canagliflozin had roughly double the risk of needing a toe, foot, or leg amputated compared to patients taking a placebo. The exact why is still not perfectly clear, but this one finding sent up massive red flags for doctors and patients everywhere, especially for those who are already at high risk.
So, you see where this is all going, right? It all builds up to this central challenge. With a medication like this, it's never as simple as good or bad. It's always a deeply personal, very careful balancing act.
And this table just lays it all out so clearly. On one side, you've got these incredible, potentially life-saving benefits, protecting the heart, protecting the kidneys, helping with weight loss and blood sugar. But on the other side, you have a list of really significant risks, headlined by that twofold amputation risk and the danger of ketoacidosis.
And what that means is that canagliflozin is the absolute definition of a drug that is not one-size-fits-all. The choice to use it has to come out of a really serious, in-depth conversation between a doctor and a patient, where they carefully weigh that person's specific health situation against this very unique list of pros and cons.
And that leaves us with the ultimate question, doesn't it? For the right person, someone maybe at very high risk for a heart attack or for kidney failure, is a drug that offers such powerful protection worth taking on these very unique and very serious risks? There's no easy answer. And that complicated math, well, that's really at the heart of modern medicine.